7 medications that harm your liver and you didn't even know. Did you know that all the medications you take are processed by your liver? Yes, that's right. The liver is the main organ responsible for detoxifying the body from chemical waste and toxins. Our kidneys also filter many impurities from our body, but when one kidney gets sick, we still have the other, and if both kidneys are sick, we can rely on dialysis machines. However, we only have one liver, and if it fails, there is no machine to support it. Therefore, we need to take very good care of our liver. In the United States, more than 2,000 cases of acute liver failure occur each year, half of which are due to improper use of medications. Hundreds of medications can harm the liver, but 7 medications are the most harmful, and it's important to know what they are and avoid them as much as possible. Let's go. What does your liver do? Mainly one thing: detoxify your body. It filters everything that enters your body, metabolizes alcohol, medications, drugs, pesticides you ingest through food, and chemicals you come into contact with unknowingly. It processes everything and expels the unwanted substances as waste, either through bile or urine. A warning: if you are taking any of these medications mentioned here and it was prescribed by your doctor, do not stop taking it under any circumstances. Many medications are necessary to control certain diseases, and if your doctor prescribed them, there is no problem. Don't worry, because they know what they are doing. Watch the video until the end, because the last medication is the most aggressive for the liver. Number 1. Methyldopa. Methyldopa belongs to a group of drugs called centrally acting sympatholytic agents. It is an antihypertensive used for hypertension. Methyldopa works by decreasing the impulses from the central nervous system that increase blood pressure. The maximum reduction in blood pressure occurs 4 to 6 hours after taking the medication. Although it effectively controls blood pressure, it is not recommended for those with liver disease, especially in cases of cirrhosis and hepatic fibrosis. The liver damage caused by this medication can start to appear approximately 3 months after beginning treatment with methyldopa. Number 2. Augmentin. Augmentin is a medication that contains a combination of amoxicillin and clavulanic acid. It is primarily used to treat a variety of bacterial infections, including upper and lower respiratory tract infections such as sinusitis, pharyngitis, tonsillitis, bronchitis, and pneumonia, among others. The clavulanic acid in augmentin helps protect amoxicillin from degradation by bacterial enzymes, increasing its effectiveness against certain types of bacteria that may be resistant to amoxicillin alone. However, this combination has been implicated in hundreds of cases of acute liver injury. Number 3. Voltaren. Voltaren contains diclofenac as the active ingredient. It is mainly used to relieve pain and reduce inflammation in various medical conditions. It is effective in treating acute and chronic pain such as muscle pain, back pain, joint pain, arthritis, postoperative pain, headaches, among others. It helps reduce inflammation associated with conditions such as rheumatoid arthritis, osteoarthritis, gout, bursitis, tendinitis, and other inflammatory diseases. Diclofenac, present in Voltaren, can cause hepatitis, which is inflammation of the liver. This can lead to symptoms such as abdominal pain, jaundice, yellowing of the skin and eyes, nausea, vomiting, and fatigue. Liver damage can occur weeks to months after starting the medication. Number 4. Amiodarone. Amiodarone is primarily used to treat severe cardiac arrhythmias, especially those that do not respond to other more common treatments. Prolonged use of amiodarone may be associated with adverse liver effects, potentially causing amiodarone-induced hepatitis characterized by liver inflammation. Long-term use at high doses can lead to the development of hepatic fibrosis and, in extreme cases, cirrhosis. Number 5. Allopurinol. Allopurinol is primarily used to reduce uric acid levels in the blood, thus preventing the formation of crystals that cause gout and certain types of kidney stones. This medication is very effective. However, allopurinol can also harm your liver. These liver damages can occur within days to weeks after starting treatment. Number 6. Methotrexate. Methotrexate is used to treat various medical conditions, primarily rheumatic diseases such as rheumatoid arthritis, psoriasis, and psoriatic arthritis. It is also used to treat other chronic inflammatory conditions such as Crohn's disease and ankylosing spondylitis. At higher doses, methotrexate is used in the treatment of certain types of cancer, such as leukemia, lymphoma, and solid tumors. In some cases, prolonged use of methotrexate can lead to the development of hepatic steatosis, also known as non-alcoholic fatty liver disease. Number 7. Acetaminophen. Acetaminophen, known as paracetamol in some countries, is a widely used analgesic and antipyretic medication for treating mild to moderate pain such as headaches, muscle pain, back pain, joint pain, and pain related to colds and flu. It is effective in reducing fever associated with various medical conditions. However, do not be fooled, as this common medication is the leading cause of drug-induced liver failure. Usually, it is not the normal dose that causes this, but an overdose. Because it is a very popular medication, people sometimes misuse it. Instead of taking just one pill for a headache, they take 3 or 4 at once. People often repeat this overdose multiple times until the liver collapses. Of the drug-induced liver failure cases, more than a third are due to acetaminophen. When taken in excess, it can cause acute liver failure, which has a high mortality rate and often requires a liver transplant if the liver does not regenerate. If you misuse this medication and also consume alcohol, it can further increase your risk of liver damage. Acetaminophen-induced liver damage can start within 1 to 3 days of taking the medication, with symptoms usually appearing within 2 to 4 days. Remember, the liver is an essential organ, and when it does not function well, it affects the entire body. To avoid drug-induced hepatitis and even, in extreme cases, fulminant hepatitis, remember that all medications should be used with great care and under medical guidance. We must always be very careful, as fulminant hepatitis affects a high percentage of those with acute drug-induced hepatitis who develop jaundice, which is yellowing of the skin. Of these, only 20% survive without a liver transplant, and as we know, getting a new liver is not easy. If you liked the video, subscribe to the channel and leave a comment below saying if you use any of these medications.